Always follow the manufacturer's directions for the proper use of high-frequency current. The two primary methods are direct surface applications and indirect applications. Direct surface application is a method most conducive for use in the barbershop. Direct surface application is performed with the mushroom or rake-shaped electrode for its calming and dermaceutical effect on the skin. The heat is generated has a sedative effect, and oil or acne-prone skin can benefit from its dermaceutical action. Dermaceutical benefits of high-frequency current are produced only with the direct application method. Direct surface application can be used by clean, dry skin, over facial creams, or over gauze for a sparkling effect. Indirect application is performed with the client holding the wire glass electrode between both hands. To prevent shock, the power is turned on after the client holds the electrode firmly and turned off before the electrode is removed from the client's hand. At no time is the electrode held by the barber or stylist. Indirect application of the current produces both a toning and stimulating effect on the skin, is ideal for aging or swallow skin. The Galvanic machine converts the alternating current received from an outlet into a direct current. The electrons then flow continuously in the same direction. This produces a relaxing response that can be generated to target specific nerve endings in the epidermis. Galvanic current is used to produce chemical and ionic reactions in the skin. This treatment is beneficial for oily skin problems and acne. The Galvanic machine has two poles, negative and positive. Both are used for different effects. Several types of electrodes are available for the Galvanic machine. Galvanic current accomplishes two basic tasks: desiccation and iontophoresis. Desincrustation is used to facilitate deep pore cleansing. To ensure proper contact, each electrode is wrapped in wet cotton and the active electrode is applied to the oily areas of the face for 3 to 5 minutes. The inactive electrode is held by the client in the right hand or is attached to a pad placed in contact with the client's right shoulder. To perform desiccation, an acid-based solution is applied to the skin surface. During the process, a chemical reaction takes place that helps to emulsify or loosify sebum and waste that can easily extract with gentle pressure. Iontophoresis is the process of using galvanic current to ensure ion-containing water-soluble solution to penetrate the skin. Negative current applied to the skin allows products with negative ions to penetrate with the skin. Conversely, positive current applied to the skin allows products with positive ions to penetrate. Products suitable for iontophoresis applications will be labeled as such by the manufacturers. The process of ionic penetration takes place in two forms: cataphoresis and anaphoresis. Cataphoresis is use of the positive pole to introduce an acid pH product, such as an estrogen solution into the skin. Products that have slightly acid pH are considered positive. The positive pole may also be used to close the follicles or pores after the treatment. Decrease redness as in mild acne, prevent inflammation after comedones and blemish treatments. Iontophoresis is the use of negative poles to force an alkaline pH product such as desiccation lotion into the skin. Products with an alkaline pH are considered to be negative. The negative pole may be used to stimulate the circulation of blood to dry skin, stimulate nerves, and soften tissues. The procedure for ionization is the same as that is used as the desiccation process. Microcurrent is a type of galvanic treatment that is used very low level of electrical current for many applications in skincare. It is best known for toning the skin and producing a lifting effect on aging skin which lacks elasticity. Microdermabrasion is a form of mechanical exfoliation that involves spraying aluminum oxide or other microcrystals across the skin surface to exfoliate dead cells. These exfoliated cells are then vacuumed off by means of suction. Microdermabrasion produces fast, visible results and can be used to treat surface wrinkles in aging skin. Although the machine and service are not standard features of most barbershops, they may be found in some high-end men's spas or grooming parlors. Light therapy is the process of using light exposure to treat certain conditions of the skin and scalp. Ultraviolet rays, infrared rays, and more currently LEDs are used to produce different therapeutic effects of the skin. Ultraviolet rays are the shorter wavelengths end of the visible spectrum and create different effects depending on the type of ultraviolet bulb used as follows: UVA rays, tonic rays, UVB rays, therapeutic rays, UVC rays, dermaceutical rays. Generally speaking, ultraviolet lamps may be used to treat acne, tinea, dandruff conditions and may produce of the following effects: increase the elimination of waste products, improve the flow of blood and lymph, assist with body in producing vitamin D, increases melanin production that produces a tan. Following are guidelines for the use of ultraviolet applications. Position the lamp 30 to 36 inches from the skin. Apply light rays to clean, dry skin. Start with a 2 or 3 minute exposure and gradually increase exposure time to 7 or 8 minutes. Average exposure may produce skin redness. Overdose can cause blistering. Protect the client's eyes with acute eye protectors. Protect your eyes with tinted safety glasses or sunglasses. Infrared generally produces a soothing and beneficial type of heat that extends for some distance into the tissue of the body. Listed below are some effects of infrared rays on the exposed skin areas. Heats and relaxes the skin without increasing overall body temperature. Soothes nerves, dilated blood vessels, and increases circulation. Increases metabolism and chemical changes within the skin tissues. Increases production of perspiration and oil on the skin. Relieves pain and sore muscles. Following are guidelines for applications of infrared ray lamps. Position lamp at a distance of 30 inches from the skin. Protect the client's eyes with the acute eye protector. Do not allow rays to remain on the skin area for more than a few seconds. Move your hand back and forth through the light path to break consistent exposure. Total exposure time should not exceed 5 minutes. A contradiction is a product, procedure, or treatment that should be avoided because it may cause undesirable side effects or be harmful to the individual. Electrotherapy should be never performed on a client with any of the following conditions: seizures, heart conditions, nerve disorders, fever or any infection, asthma, pregnancy, high blood pressure, open or broken skin, sinuses, pacemakers, metal implants. If in doubt, request the client get approval from their physician before receiving electrotherapy treatment. It is especially important to handle electrical equipment safely when applying a device to a client's skin or scalp. Adhere to the following safety precautions when using electrical items in a barbershop. Disconnect any appliances when they are not being used. Study instructions before using any electrical equipment. Keep all wires, plugs, and equipment in a safe condition. Inspect all electrical equipment frequently. Avoid getting electrical cords wet. Clean and disinfect all electrical property. Protect the client at all times. Do not touch any metal while using electrical appliances. Do not handle electrical equipment with wet hands. Do not allow the client to touch metal surfaces when electrical treatments are performed. Do not leave the room when a client is attached to any electrical device. Do not attempt to clean around an electrical outlet when equipment is plugged in. Do not touch two metallic objects at the same time while connected to an electrical outlet. Do not use any electrical equipment without first obtaining full instructions in its care and use. Protection and safety of the client should be your primary concern, as carelessness can result in shocks or burns. Barbers who practice safety precautions help to eliminate accidents, ensuring greater comfort and satisfaction for their clients. Barbers do not treat skin disease, however, they should be able to recognize various skin disorders that need to be referred to a physician. Facials performed in the barbershop are considered to be either preservative or corrective treatments. Preservative treatments help maintain the health of facial skin through correct cleansing, toning, and massage. Corrective treatment corrects skin conditions such as dryness, oiliness, blackheads, aging lines, and minor aches. As with other forms of massage, facial treatments help to increase circulation and metabolism, relax the nerves, active skin glands, maintain muscle tone, and improve skin texture complexion. There are 4 basic skin types that the barber will need to be able to recognize before the appropriate products can be chosen for a facial treatment. Skin type is primarily based on the amount of oil that is produced when the follicles form, the sebaceous glands, and the amount of liquids found between the cells. Dry, normal, combination, and oily are the 4 basic skin types. Any of these skin types can be sensitive to products, irritation, or the environment. Dry skin does not produce enough sebum to prevent the evaporation of cell moisture. This leaves the skin in dehydrated state. When analyzed using a magnifying lamp, dry skin may be flaky or dry looking with a small fine lines and wrinkles. The objective of a facial treatment for dry skin is to stimulate oil production for protection of the skin surface. Hydrating the skin with moisturizers and humectants in addition of drinking plenty of water can help minimize the negative effects of dryness and dehydration. Normal skin has a good water-oil balance. The follicle pores are a normal size and the skin is free of blemishes. Maintenance and preservation care is the goal for this type of skin. Oily skin is characterized by excess sebum production and may appear shiny and greasy. The follicle size is larger and contain more oil. Oily skin requires more cleansing and exfoliation than other skin types, yet over-cleansing can strip and irritate the skin. If the skin is over-dried, it is not balanced and the body will not try to produce additional oil to compensate for the dryness of the surface. Proper exfoliation and water-based hydrator helps keep oily skin cleansed and balanced. Combination skin can be both oily and dry in different areas of the face. The T-zone in the section of the face that incorporates the forehead, nose, and chin area. These areas tend to have more sebaceous glands and larger pores. The cheeks and outer areas of the face tend to be dry. Water-based products works best for combination skin types. Wrinkles are depression in the skin that have developed from repetitious muscles action moving in the same direction. Other factors that influence the formulation of wrinkles include loosening of elastic skin fibers due to abnormal tensions or relaxation of the facial muscles, shrinking the skin tissue as a result of aging, access of dryness of the skin, and proper facial care. It is preferable to analyze the skin with a magnifying lamp or light, but if one is not available, a close inspection of the skin will suffice. When analyzing the skin, it is important to note the client's skin type and condition of the skin, visible appearance and texture. Guidelines for performing a skin analysis and client consultation, including the following: observe client skin types, conditions, and appearance. Feel the texture. Ask the client questions relating to the skin appearances and home care routine. Discuss the facial procedure and treatment plans, as well as products that will be used and why. Encourage the client to ask questions and then determine a course of action together. Record information for the client's next visit. There are many types of skincare products available for use in a barbershop or for the client's home use. These products, usually designed for specific skin types or conditions, can be categorized as cleansers, exfoliants, skin tonics, masks, and moisturizers. Products such as toners, massagers, creams, and moisturizers will be used following a shave service. Cleansing products should be mild and easy for rinse from the skin. They are available as face washes, lotions, and cream for different types of skin and skin conditions. Face washes are usually water-based products with a neutral or slightly acid pH effect on oily and combination skin types. Cleansing lotions are water-based illuminations for normal and combination skin that contain emollients or oils to soften the skin. Cleansing creams are heavier oil-based emulsions that are used primarily to dissolve dirt and makeup. Skin tonics, which include fresheners, toners, and estrogens, help to rebalance the pH of the skin, remove products, residue after cleansing. Skin tonics have a temporary tightening effect on skin and vary in strength and alcohol content. Fresheners usually have the lowest alcohol content and suitable for dry, mature, and sensitive skin. Toners are designed to tone or tighten the skin and may be used on normal and combination skin types. The alcohol content range of toners usually 4 to 15%. Estrogens may contain up to 35% of alcohol and may be used for oily and acne-prone skin. Moisturizers are formulated to add moisture to the skin surface. They contain moisturizers attracting humectants and emollients that prevent moisture that evaporating from the skin. Moisturizing creams and lotions are available with very humectant to emollient ingredient ratios for dry, normal, and oily skin type. As barbers, you will use moisturizers as one of the final steps in facial and shave services. Mechanical exfoliations are products that help to physically remove dead cells from the skin surface and to clear clogged pores. Granule scrubs are available in cream, lotion, and gel forms in a variety of skin types. Rolling creams is thick, smooth, exfoliating cream, used pink in color, which has used in barbershops for decades. It is applied in thin layer over the skin and then rolled off with firm stroking motions. As the rolling takes place, dead cells build up and trapped impurities are lifted from the skin surface. The skin is left soft and smooth with increased circulation to the surface. Rolling cream should be used on clients with normal, oil, or thick skin. It is not recommended on dry, acne-prone, sensitive, or thin textured skin. Chemical exfoliants such as alpha hydroxy acid or ammonia pads loosen or dissolve dead cells buildups on the skin surface. The use of chemical exfoliants requires advanced training and in some cases certification to meet compliance standards. Masks help to draw impurities out of pores. Depending on the ingredients, they can be tighten, tone, hydrate, soothe, or nourish the skin. They are available in cream, gel, or clay forms and should be used according to the skin type. These products differ in their composition and application as discussed below. A mask is usually a settled product, which means that it dries after application, providing complete closure to the environment on top of the skin. Masks are most often applied directly on the skin and are known for their tightening and sebum absorbs effects. Clay masks are used to stimulate circulation and temporarily contact the skin pores. They absorb sebum and they are used in oily and combination skin types. Applied with a mask brush, they are allowed to set until dry, usually about 10 minutes. Cream masks often use humectants and ointments and have a strong moisturizing effect. Consequently, they do not dry hard like clay masks do and are often used on dry skin types. Gel masks are hydrated and soothing ingredients to add moisture to sensitive or dehydrated skin for a more suitable appearance. Paraffin wax masks employ the pack application method. Specifically prepared paraffin is melted at a temperature that is slightly higher than the body temperature before application. The client's skin is prepared by cleansing, followed by the application of a treatment cream. Eye pads are used and the paraffin is applied over gauze to prevent the facial hair from sticking to the wax. Gauze is often used to hold cream or gel masks in place over the skin or to prevent paraffin wax from sticking to the skin or facial hair. High quality masks and packs should feel comfortable while producing slightly tingling and tightening sensations. Follow the manufacturer's directions for preparation, application, and removal of the products from the skin. Massage creams, lotions, or oils that provide slip during a massage while also softening and moisturizing the skin. A general outline of the order in which skincare products will be used during a basic facial treatment in this text as follows: cleansing cream or lotions, exfoliants, massage cream, cleansing cream or lotions, fresheners, mask or pack, toner or astringent, moisturizer. However, your instructor recommend order of product applications will be equally correct. There are many product lines that have been developed specifically for males in mind, and each year more men are experiencing benefits of using skincare products on a regular basis. When choosing men's care product for the use of barbershop, it is important to think about the specific characteristics of products that might appeal to men. For example, some men do not like high fragrance or multi-step products. Creams should be simple, non-fragrant, and absorbent with a matte finish rather than a greasy or oily. Men also seem to prefer simpler routines and multi-purpose products. For example, a skin tonic that also serves as an aftershave may be chosen over the purchase and use of two separate products. Although the quality of product must be the first consideration choosing products, packaging also needs to be taken in consideration. Typically, tube packaging is preferred over jars, and size can be a factor for clients who travel often. One option is to stock retail shelves with larger containers for clients' home use and smaller, more convenient sizes for travel. Smaller packages good can also use for shop promotions and marketing strategies. As a general rule, any product sold in a barbershop should also be visible on back bars and stations used during client services. As a professional barber, you should be able to provide different facial treatments and products for different skin conditions. Review the following sections to be more familiar with the types of facial treatments you should be able to offer your clients. The basic facial, sometimes known as scientific rest facial, is the foundation for all other facial treatments covered in this chapter. A basic facial includes cleansing, exfoliating, massage manipulation, toning, a mask or pack, and moisturizing. These actions help to stimulate the functions of the skin while exercising or relaxing facial muscles. A vibratorial facial is often performed using a combination of the hand and electric massager. To avoid heavy contact or pressure that can be uncomfortable for the client, you will need to learn how to apply the electric massager to the client's skin directly and indirectly. Direct application is performed by attaching the massager to dominant hand and allowing the vibrations to travel through fingertips or palms of the client's skin. This method is appropriate for less sensitive facial areas such as the jaw or forehead. Indirect application requires that you place your non-dominant palm or fingertips on the client's skin with the hand holding the massager on top of your hand. In this way, the vibration will flow through your non-dominant hand before reaching the client's skin, making the vibration more suitable for delicate areas such as those around the nose and upper cheek. Dry skin is caused by an insignificant flow of sebum from the subcutaneous glands. The objective of a facial for dry skin is to help moisturize it. Dry skin facial can be stimulated with infrared rays, galvanic current, or high frequency current to help stimulate sebum protection. Oily skin or blackheads are caused by hardness masses of sebum and formed inside a follicle. The subcutaneous material in the follicle darkens when it is exposed to oxygen and forms a blackhead. Acne is a disorder of the subcutaneous glands. Clients with this serious condition requires medical attention. If the client is under medical care, the barber may be able to perform facial treatments prescribed by a client's physician as indicated on the prescription depending on the state rules and regulations. If in doubt, contact physician and your state barber board directly. Because acne contains infectious matter, you will need to wear gloves and use only approach movements to apply gentle massage or products to avoid spreading infection matter to other areas of the client's skin. With a physician-prescribed treatment plan, barbers are limited to performing the following related procedures: reduction of oil on the skin through typical application, removal of blackheads using improper procedures, applications of medicated or prescribed preparations. To ensure successful facial treatments that can result in repeat bookings and referrals, help the client relax by speaking in a quiet, professional manner. Explain the benefits of the service and products during the consultation. Provide a quiet atmosphere. Work efficiently. Maintain a clean condition and arrange supplies neatly. Analyze the skin and follow a systematic procedure for performing the facial. Protect the client's eyes when applying products. Keep your nails smooth and short to avoid scratching the client's skin. Keep your hands smooth. Always test hot towels before applying them to the client's skin. Avoid excessive or rough massage manipulations. Avoid leaving excessive products on the skin. Avoid excessive conversation that do not facilitate client relaxation.